Hello and welcome once again to Moorgate Andrology. Now in today's video I want to talk about penis enlargement surgery and in particular the prospect of a second fat transfer procedure. So the most common procedure in the UK when it comes to penis enlargement is what we call length and girth surgery. Length and girth surgery. This is a surgical procedure to increase the penis length when it's flaccid, and to increase the penis girth when it's flaccid and erect. Now, when we do the fat transfer aspect of the penis enlargement, it's normal for around 30% of the transferred fat to absorb. This is a natural phenomenon, a natural process that always happens. Even though the fat is purified before it's injected into the penis and after it's taken from the belly or the inner thighs, there is still this absorption process that happens. But typically, we transfer around 80 to 100 mils of fat now, so even after the absorption, the results are very good, with most patients getting around 1 inch increase in girth, both flaccid and erect, depending on the specific absorption for that patient. Now, in some cases, guys do like to come back and have a second fat transfer sometime after the first. And this is because they usually like the look of their penis in the very first weeks when they perhaps had 100% of the transferred fat, and maybe not a little swelling too. So how the penis looks in the first 6 weeks after penis enlargement surgery is not how the penis looks eventually, because it takes time for everything to settle down. The swelling has to disappear, the 30% of the fat has to absorb. So it needs this period of healing of around 6 to 8 weeks to see the final result. But after then, some guys like to come back and have a second fat transfer. And many ask, is this possible? Is it possible to have a second fat transfer after the first? And of course the answer is yes. I think it's true to say that at Moorgate Andrology, most men are happy after one fat transfer, and that the guys that come back and have a second fat transfer are looking for substantial girth on their penis. Some urologists believe that the second fat transfer is even more successful than the first, because the body has, or the penis shall we say, has already a layer of fat there from the first surgery. The second fat transfer is obviously the same as the first. The procedure is the same. We harvest some fat from the stomach or the inner thighs where the best quality fat is, and then after a purification process, this fat is then injected into the shaft to thicken it once again. The healing time is very similar, although a little bit shorter if you've not had the ligamentosis surgery at the second fat transfer. Most guys have ligamentosis surgery to increase penis length at the first operation, and then that's followed by just a fat transfer at the second operation. And if it's just a fat transfer at the second operation, the recovery time is a little bit quicker. Whereas normally it's around 6 weeks, the recovery with a fat transfer typically is around 4 weeks. But it's really important after the second fat transfer that you follow the same massage regime. Remember, as that fat settles down, we want to keep everything nice and symmetrical up and down the penile shaft. And therefore, you'll follow a daily ritual of massaging for around 5 to 6 times a day for just about 2 minutes over the following 3 to 4 weeks. So there we go. A second fat transfer is possible after the first one to get even more significant girth to your penis. If you'd like to talk to us about any aspect of penis enlargement surgery, then please do get in touch with us here at Moorgate Andrology, and we can arrange a consultation for you with one of our urologists. That's all from me today. I look forward to seeing you back here at Moorgate very soon. But until then, bye for now.